Life is the most precious gift we are given as human beings. But life is a gift not promised to last forever. It requires care and diligence to live a happy and healthy life. It requires good health care to live a healthy life. The decisions we make today will directly affect the quality of our lives and shape the future for our loved ones. I would like to have a discussion about healthcare. I want to help you get to the truth. My name is Mike Harris, and I have been a professional healthcare provider for more than 20 years. Let me share my knowledge and insight with you as we strive together to live a longer, healthier life. Welcome to the Nurses Station. Hi, my name is Mike Harris, and welcome to the Nurses Station. Many of you may remember my previous program, Mike's Nurse Talk Show, which I'm proud to say has aired here at BronxNet TV for the last year. Let me explain to you why I'm so passionate about great health care. This story starts with my little sister, Martrice Murray.
My daughter's name was Martrice Louise Murray. Her birthday was October 3rd, 1966.
My sister's name was Martrice Murray. She was my baby sister.
If I had to pick 3 words to describe my daughter Martrice, I'd say love, love, love.
I would say intelligent, beautiful, witty.
Martrice was so attached to me, she loved to be around me, stick around me forever.
She was into my mother. she hung with Mom.
Martrice would try to help me cook. She was trying to help me clean and do little things, just to help me. And she loved to play. She loved to play, sing, and dance. She was a happy child.
Well, I found out my sister was intelligent and she was witty and she was fun and she loved me. And she told me that.
My daughter Martrice was a very good parent. She used to study, teach her children how, really good manners and everything that a good mother would do.
My fondest memory of my sister is when she had her first housewarming. And it was a time where I could contribute to her home. And she had all of the family there and a lot of food. And I seen her happy. And that was important to me.
I first found out about Martrice being sick maybe 15 years ago. She told me that she had HIV and she was about to go into the hospital. I was terrified. I was very terrified to know she had to go into the hospital.
6 years prior to her passing, I had found out she was sick. And it was like a brick hit me when I found that out. I can't recall who told me. I think she told me. I think she told me she was sick and she explained to me how she got sick. It was like a brick had hit me because she's young and at the time the way she had gotten sick was new to the community. And it was scary, and I felt really bad because my sister had children, and I knew that it was very serious.
Martrice was not very sick in the beginning with the HIV, but as it progressed, she started getting very sick. She was in great pain. She hardly ate.
I remember my family was devastated about it. I remember My mom was very upset about it, and my brother.
Matrice's last hospital visit, she was scared to stay in the bed. So me and my husband would go and sleep in her bed while she sit up on the couch until the nurses would come in and tell us we couldn't do that. So then she'll lay down and then we sit on the couch and when she said, I'm not going to sleep, Mommy. I'm not going to sleep because I don't, I'm scared to go to sleep. So, and then the next thing, she was preparing to come home to get a hairpiece because her hair was falling out. So we was, looking through books trying to get her a hairpiece.
Yes, the last time we spoke, she was in her hospital bed. I had spent the night, and she was talking about the men that came. There was these guys that would come and teach her the Bible. And she talked about God, and we talked about God, and I told her it was going to be all right. And I remember her falling asleep, and I fell asleep in a chair at the hospital. When I woke up, she was like asking me, why did everything move? Why did everything on the table move? Which it had not moved. I guess that it was like, some type of hallucination, or she was sleeping and had a dream. And I told her I loved her and I was going to return. That was the last conversation.
How did you?
I was in school and someone from the family called me and told me that she was passing. So I needed to get down there quickly, and I left school and I drove down to the hospital before and when I got to the hospital, she was passing. She had taken her last breaths while I was there.
Last time I saw her, I went to the hospital and took some of her clothes and took them to the laundromat. And when I came back, we were packing those clothes here because she was planning on coming out. And the last day was when they called me and told me to come to the hospital.
It really hurt to see my sister gone at such a young age, so beautiful. It really hurt me, and I really had a sense of I lost my sister. I didn't get a chance to really know her.
Oh, Matrice, girl, I love you so much. I miss you. I really miss you, girl. You was my baby.
Proper procedure for what should have been done at that bedside would have been to stay with the patient, make sure that the sutures were in, document what was done, and have the nurse that is the primary nurse for that patient at the bedside. And not always have the family leave for these procedures as they had us do. And my sister, as I said, she bled to death because since it was not sutured, the heart rate is beeping so hard, pushed it out, and of course she bled to death. So the only thing that I always say is the best way to handle stuff like this is to have great preceptorship, have that baton passed down, have the documentation in order on why the patient actually, succumbed to either the disease or a treatment modality like that one. Again, I do not blame anyone, and I don't blame the practitioners, because it's a system that needs to be corrected. Where we have great advancements in medicine, we have great advancements in practice, in nursing practice and medical practice, but when these little incidents turn into death, it needs to be looked at. How well my sister's death was looked at is still very convoluted. It's something that I would like a change to happen within the medical profession.
Don't say that.
Left-handed people, a little bit more creative. I'm going to say nothing.
Left-handed people are smart.
They are.
Mom, I have a We're really happy. I have a Dad, do you want to get the phone?
No.
Every year, 1 million families face losing their homes to foreclosure. If you're ignoring your mortgage issues, things will only get worse. Call 1-888-995-HOPE because nothing is worse than doing nothing.
When I have an asthma attack, I feel scared. Sometimes my parents have to take me to the hospital. I feel like a fish with no water.
You know how to react to their asthma attacks. Here's how to prevent them. Call 1-866-NO-ATTACKS. Visit www.noattacks.org or call your doctor. Because even one attack is one too many.
Hey, how's it going?
Sir, are you okay?
What? Oh, this? It's probably nothing. I'm sure it'll go away.
Go away? But, sir, that can't be good.
No, it's cool. Really.
Do you want a napkin or something?
Everything's fine. Thanks.
You wouldn't ignore this. So why ignore the signs of a stroke? At the first warning signs, call 911 immediately. Because time lost is brain lost.
I wish my problems with the medical profession would have stopped there. But let me tell you about my father, Perry Mary.
My first memory of my dad is when I was a little girl. When I used to cry, he used to pick me up and he used to hold me. And I remember his eyes. I remember him looking at me. My dad was loving and caring.
He was really a homebody. We would talk about historical things, mostly about family, what happened in our community and how the changes have occurred. He gave a lot of history on just how we really should look at ourselves and what we should do with our lives. He made sure that I took a trade before going to college. He always prepared us to be able to work for ourselves and do for ourselves before going to college.
I used to love going to the restaurant Carmine's with him. I used to love going there and eating dinner with him and having conversation afterwards. I think more so, my dad was a conversationalist and I really love having conversations with my dad. My father and I were friends. So my father was not the traditional father. We were friends and we talked and we hung out together. We talked about many things. I would go to my father, I would tell my father my deepest and darkest secrets, and he wouldn't hold it against me, and he wouldn't judge me.
Unfortunately, my dad had a bad habit of smoking cigarettes. In 2000, he was diagnosed with emphysema, and in 2004, he was diagnosed with lung cancer. My dad remarried late in life, and because of that, his immediate family were no longer his healthcare proxy. The way I found out about my father's lung cancer was when his wife gave me a call to let me know that. And she told me he agreed to speak with me about it. My sister and I then had a conversation about it because my father's wife had called her as well. And my sister had told me they had already made a decision that he was going to have surgery on his lungs. Immediately I was disturbed about it because I said, well, Dad smoked for 40 years and his quality of life is great because I visit him all the time. He was very proud of me becoming a nurse. He was very proud of me, but he didn't want to talk to me now about his healthcare situation. And I was disturbed by that because I had then received a phone call from his wife telling me that they really did not want to talk to me about it because, again, this all came through the grapevine with me and my sister talking.
My dad had said that the doctor found a spot on his lung and he was going to go in for an operation. And he didn't ask, should he? He was just saying that he was going to go in, and it was in a couple of weeks from the time he told me. The way that he explained it was so, it was like minuscule, and it wasn't really all that important. So what he had said was, yeah, they found a little spot on my lung, you know, and I'm going and they're going to take it out, and he did it like that. But, you know, being that it was my dad, I was a little scared, you know, but the way he explained it, it took some of the fear away.
At that point, I was really disturbed that my dad had chose to have, you know, lung surgery on his lungs when he smoked for over 40 years. And as I had said to my sister, he's supposed to have lung cancer, or even if he didn't, he did have lung cancer because he smoked. And the fact that he had emphysema on top of it, he was not a candidate for surgery.
I saw the surgery because my dad had said it so like nonchalant. I saw the surgery as not particularly a problem. And so we were on two different planes with this, the surgery. So when the way I seen my father and the way Mike seen the whole thing, my father and the whole situation was totally different.
They all went against me because I was a nurse. And it was a really hard pill to swallow because this is the worst right I ever wanted to be.
I found out it was serious when he couldn't, they said that it was serious, really. They told me it was serious, that he had pneumonia and he wasn't doing too well.
Although I didn't have all of the diagnostic facts, I didn't need them. I did know my father's quality of life. He was able to perform all of his ADLs, go out and walk for 2 miles or more. He shopped every day practically at Food Emporium, which was on 90th Street and Broadway. And he had a basic quality of life. The doctor had given him a great chance of surgery. He said the surgery would be successful. My argument was that yes, his surgery would be successful, but how would my father's life be after that? I questioned that. In fact, I spoke with a lawyer after that. I was told there was nothing I could do. My family fought against me. That particular surgeon, during that time, I did have a chance to meet. I met him right after the surgery. My family had dispersed out of the waiting room. The surgery had went on too long. I had appeared 2 hours later, and the surgeon had called the Murray family. I went in and I spoke to him, and when I asked him why did he choose to do surgery on my father, he said because he thought he would have a good chance. And it took everything out of me to not perform in a very unprofessional manner.
This time Mike had been going through a whole lot prior too, but I had, like I said, I didn't take it like it was all that bad until at that point when they said he had gotten pneumonia and he had tubes all in him. He had a bag, and Mike had come to the hospital, been at the hospital, I think, and he was asking questions to nurses, doctors. He was trying to convince people of things or find out things from the doctors and the nurses, while I'm just in shock.
So I left that room very disturbed, and a few hours later, he brought my father out into the recovery room with a saturation rate. I don't know, I'm going to have to explain saturation. It's a blood oxygen level within the blood system that was so low that I knew my father was not going to survive. through the night, he didn't. The nurse that was caring for him was a nurse that we worked together in a previous hospital at the time, and she was now the ICU nurse in the recovery ICU for my dad. She explained, as I asked her, to my family at that time, because legally there was nothing I could do, and emotionally it was really hard for me to deal with my family as well at that time, but I did want to be there for my dad. She did take the opportunity and explain to my family she would have never had her father have surgery at 71 years old on his lungs after smoking for 40 years, and had a quality of life of ambulation and a quality of life that was sustainable until palliative care could appear. There was no reason to have surgery. And it was definitely, like I said, one of the worst rights I've ever had to feel, and my father died through the night.
The last memory I have of my father is sitting in his room with the machine, looking at the machine with the numbers going down.
This is Jack Thomas. Today, someone almost brought Jack something to eat. Someone almost drove him to a shelter. And someone else almost brought him a warm blanket. And Jack Thomas? Well, he almost made it through the night.
How you doing?
Hi.
Hi.
Have a nice day.
You too.
Thanks.
If only child abuse were this easy to recognize. If you even suspect abuse, call 1-800-4-A-CHILD. All calls are anonymous and confidential. Trust your instincts.
Gotta get that. Oh, I must be careful there. Well, that's a nice picture.
Come on, Anna.
Okay.
Foreclosure doesn't affect just you. It affects your whole family, too. If you've fallen behind on your mortgage, we can help. Call 1-888-995-HOPE, because nothing is worse than doing nothing.
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. Finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.
So let me tell you what went wrong. My father had his health insurance, and he had an in-network provision and an out-of-network provision. The in-network provision is where you have doctors within the same network. That network means you have two doctors in the same hospital or same facility or in the same organization to give the diagnosis. When you have an out-of-network provision, that out-of-network doctor does not have any connection to those two in-network doctors. My dad did not take the option to have an examination by an out-of-network provider against my request. Out-of-network doctors usually have an unbiased opinion. They do not go along with each other for many reasons. Most of the reasons because they're getting two different stories, they're getting two different readings, they're getting two different testings. Opposed to in-network doctors, they get those same testings, and they usually agree on those testings without having any other testings done. What my father could have done was have those other testings done outside of the network without paying for them, which was a great benefit, but he didn't take advantage of it.
I think that if he had a second opinion, things would have gone differently. In retrospect, my father wouldn't have had surgery. In retrospect, I would have really stepped in much more than I did. I wouldn't have let, if I would have listened to Mike and knew that this would happen, yeah, I would have stepped in. I don't think he would have had the surgery. Dad, I love you, and I wish I was there for you. But I didn't know. I didn't know.
That's the very reason why I do this show, so I can give you the information that will help you advocate for yourself. Things are even worse now. Those out-of-network benefits are no longer available to you. I don't want you to lose your life or the life of a loved one unnecessarily. My name is Mike Harris, and thank you for watching The Nurses Station. I'll see you next week.
Barry, time is running out. According to my calculations, 1 in 5 kids in America struggles with hunger. How can so many children face hunger when there's more than enough food to feed them all? You're right, Barry. We can help solve hunger by teaming up with Feeding America to get food to hungry kids in communities across the country.
Help Flint and the Feeding America network of food banks get food to the people who need it in your community. Find your local Feeding America food bank at feedingamerica.org/hunger.
Together, we're Feeding America.
And we're out.
You got plans?
You bet.
50 million Americans struggle with hunger, but we can do something about it.
Excuse me. What's going on?
Dinner. Please join me in helping put food on their tables. Together, we can feed America.
You guys keep going. I'm gonna get the plates. Plates?
Find your local food bank at feedingamerica.org/hunger.
Everybody has a dream. Mine was to see the ocean. And with a little help, I made it.
A full life, measured in seats, starts with the right ones early on. Car crashes are a leading killer of children 1 to 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
There's no place like home.
Getting home safely is just a click away. But making sure your child is in the right seat is just one of the steps down the road to safer travels.
I don't know how it works.
Find the right seat for your little one's age and size.
We've done what you told us.
There's no better way to get home safely. Know for sure that your child is in the right seat. Get all the facts at safercar.gov/the right seat. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.